teams of people together. No one person's going to be able to solve malaria, just like no one person could land a man on the moon. And so we had.
Malaria is a mosquito-borne disease that is caused by a parasite. 3.2 billion people are at risk in 100 countries around the world. Malaria has been explored for more than 4,000 years. It was first recorded in Chinese medical journals in 2700 BC. In 4th century BC, Greece encountered malaria and found it as a cause for the decline of city-state populations. In the age of the Pericles, there are more references to malaria in literature and in the general population. In 1880, Laveran, a French army surgeon in Algeria, noticed parasites in the blood of a patient suffering from malaria. In 1886, Camillo Golgi was an Italian neurophysiologist that established that there are two types of the disease: tertian periodicity and quartan periodicity. In 1897, Ronald Ross, a British officer in the Indian Medical Service, discovered that malaria can be exchanged from patients with malaria to mosquitoes that bite the infected patient. He also discovered that malaria can be transmitted to birds. In 1934, Hans Andersog discovered chloroquine, and it was recognized as a safe and effective anti-malarial still used today. In 1947, Louis LaVale Williams proposed the National Malaria Eradication Program. In 1951, malaria was close to being eliminated in the United States.
The malaria parasite's life cycle is very complex, involving many stages. As the mosquito feeds, malaria sporozoites enter into the human bloodstream. They quickly make their way to the liver and infect liver cells with the help of the circumsporozoite protein. The parasite develops into mature schizons, creating tens of thousands of merozoites, which burst out of the cell and journey back toward the bloodstream. They then infect healthy red blood cells, reproducing and eventually rupturing the cell, liberating more merozoite, which in turn go on to infect other cells, leading to the massive destruction of red blood cells. A few of the infected cells develop into gametocytes, which can remain in the bloodstream for several days and may be ingested by another mosquito during a subsequent feeding. Inside the mosquito, the gametocytes develop into new sporozoites. So now the human has infected the mosquito. The life cycle comes full circle and continues.
Malaria is transmitted through the bite of a female mosquito named Anopheles. There are only around 400 species of Anopheles, but only 30 are malaria vectors. There are many things that affect the transmission of malaria, such as the lifespan of the mosquitoes, the climate of the area, and the human's immunity to malaria. In the United States, malaria is more likely to be spread and exchanged in certain conditions. Airport malaria is when infected mosquitoes are transferred by airplane from a malaria-endemic country to a non-endemic country. Sometimes mothers who are pregnant with malaria transmit parasites to their fetus during pregnancy or during delivery. Transfusion-transmitted malaria is rare, but can be encountered as a problem in blood transfusion. 3.2 billion people in 2015 were at risk for malaria. That's almost half the world's population. 97 countries had ongoing malaria exchanges in 2015. Most malaria cases and deaths occur in Africa, Asia, Latin America, and the Middle East and parts of Europe. These people who are more at risk include infants, children under 5 years of age, pregnant women, and patients with HIV and AIDS, and travelers. There are two types of malaria: uncomplicated malaria and severe malaria. People encounter uncomplicated malaria for 6 to 10 hours. There are 3 stages called the cold stage, hot stage, and sweating stage. Symptoms of uncomplicated malaria consist of fever, chills, perspiration, nausea, body aches, weakness, and headaches. Severe or complicated malaria symptoms include kidney failure, low blood pressure causing cardiovascular collapse, seizures, and coma, these sometimes leading to death. Malaria diagnosis can be very difficult. There are different types of diagnosis that have been explored, such as microscopic, antigen, and molecular. Microscopic is examining the blood of a patient under the microscope. Prior to examination, the blood is stained to be able to identify the parasite. Antigen tests usually use a dipstick or a cassette format, and the results are fast, 2 to 15 minutes. These tests are useful when microscopic diagnosis is not readily available. Molecular is when the parasite's nucleic acids are found using polymerase chain reactions.
Treating malaria is different from person to person depending on pregnancy, type of parasite, medical status of patient, and drug allergies. The different type of drugs you could use to treat it are chloroquine, atovaquone, artemether, mefloquine, quinine, quinidine, and doxycycline. The most commonly used is chloroquine. Chloroquine is an anti-malarial. It is available in the USA by prescription only. It is sold under a brand and it is sold as a generic medicine. Side effects of chloroquine are stomach pain, nausea, vomiting, and headache. This drug has not been found to affect pregnant women and their fetus.
In sub-Saharan Africa, malaria kills 1 child every minute. In the Sahel region, when the rains come, cases of malaria increase significantly, putting children under 5 at even greater risk. To protect the Sahel's 25 million children, the World Health Organization recommends seasonal malaria chemoprevention. Malaria cases fall by as much as 75% when SMC is used alongside other preventive tools.
Exploring a place where the possibility of encountering malaria is high may be scary, but there are preventive measures that can be taken to ensure health. Anti-malarial drugs are available to use prior to traveling, reducing exposure to mosquitoes by sleeping under a mosquito net and covering skin are also ways to protect from getting bitten.
This disease not only affects people in Africa, but all over the world. The exploration of malaria has been taking place for thousands of years, starting with the Chinese in 2700 BC. By taking preventive measures before encountering malaria firsthand, the exchange of malaria can be stopped.